can move on to our next speaker, Mike Shelanski.
I thought it'd be just interesting to know what those of us who unfortunately have not been able to engage in some of the exciting research projects going on, or unfortunately I've been banned from clinical practice because of my age. They figure that I'm too likely to become a patient. So what I've done is use the Office of Research at the medical center, which is supposedly the office that helps you do research. We want to make your life easier. I think you've all heard that and disbelieved it at various times. So various things we have done early in this that first of all was to manage the ramp down, to try to get each laboratory at the level that it could continue to keep their key animals, their key cell lines, their key reagents going. And at the same time, to allow those laboratories that were focused on COVID-19 or wanted to be focused on COVID-19 to expand. Quite frankly, the ramp down was an emergency procedure. It was done with enormous cooperation from the faculty, and it was far from a perfect event. Nonetheless, that has resulted in the times I've walked through the corridors of the building to say that social distancing is extreme. Most people are not in it at one time. The other thing we've tried to do is to encourage people who have skill sets that are relevant to research going on to work with the laboratories that have the research going on. And we have such examples as very senior National Academy members like Rod Rothstein working actually with Alex Chavez, who's assistant professor in pathology, in trying to identify new drugs on a novel fungal screen. So again, we've been a matchmaker in that. We've tried to keep the flow of grants, applications going in. After all, if you're sitting on your hands at home, it's probably a good time to catch up with your reading, analyze your data, think about what's going on, and to try to bring tools to the investigators that would help in various ways. So there have been 3 initiatives that we've had. One is Minor, which we've put out for, if anyone reads it, a sort of cute weekly newsletter, including what you might do when you're not doing science, what's streaming online. The second thing is we've worked extensively in trying to develop to extend the Columbia University Biobank to COVID-19. And this has been probably where we put most our effort in. This is based under Murdoch Riley and the CTSA. And it includes specimens from the clinical laboratory, specimens from patients, and somewhat uniquely tissue specimens from autopsy. It's been quite a bit of procedure to set up the flows. We find people, not surprisingly, want to do things and haven't worked with human tissue, or have an idea and don't have a laboratory, because not all ideas are people in laboratories. So again, it's been matchmaking and developing how the flows of how we do this, putting the groups together to decide who has the best argument for a rare tissue resource, or do we have enough to pass it around. And I can think, quite honestly, a number of investigators have felt we have moved too slowly, and the only excuse I have is that sometimes you just can't move as quickly when you're not on site and can't just grab somebody by the neck or move a freezer from A to B. So the biobank is up. It has now plasma, it has serum, it has swabs, it has urine, it has tissue, and it is taking requests from within the university. Requests from outside the university, we're only accepting by email. We're not closed to giving specimens out. We just don't have the staff to go through, hundreds of requests from outside. But if people email us, we have a little thing they can fill out. And obviously, if someone has a Columbia collaborator, that makes things easier. We've also had a team on the ground to deal with emergency resources for science. So for example, John Smurden in our office has been in and really made sure we got the freezers, the incubators, the hoods, everything installed so we could do our serology laboratory, where our results have been parallel to those that you've just heard. But interestingly, the papers that are beginning to come out are very informative, and I just like to share, for instance, the conclusion, not at all my work, but from David Ho and Eldad Hode in pathology, that it turns out they've looked back because clinical laboratories keep samples, and they think by the time we saw the first case of community transmission in New York, which was March 3rd, there were actually tens of thousands of infections in the city. So this thing was spreading long beforehand. And, this will be refined and going on, but it wasn't just that it arose in New Rochelle on one evening and escaped to us. So again, we are the SWAT team. If your freezer breaks down, if your incubator doesn't work, if we have actually a series of reserve freezers put away on the second floor of the Black Building, and we have people who will run around and keep your lab in business. The other thing which we, together with really enormous cooperation, you'll hear the end more from Howie Wu later in this session, was to build what we call the COVID Hub, which is a database of research here at Columbia. When this was first proposed to what we call the RLCC, which is the Research Leadership Coordinating Committee or Council, I don't know, which operates out of the Executive Vice President for Research office downtown, consists of myself and the Deans of Research in Engineering and Arts and Sciences and up at Lamont. They were talking about, this might be up in beta form in 3-4 weeks. Thanks to Howie and the crack team, which Ken Olive put together, and enormous input from Jeanette Wing, this thing is up and running. And I think that's gives you a chance to, when you want to do a type of research, or you have a thing you think might be interesting to exploit. I'll give you a good example. We have one investigator who is very interested in the algorithms you might design to batch test people for viral infections. So when you go to a public health thing, if you have to assay everybody walking in the door of a school, you're going to have 1,000 kids, 1,000 assays every day or every week, however you want, at $100 an assay. But if the infection rates are actually low in the population, you could screen 100 at a time, and then 100 that had no reactivity go right through, and if you have reactivity, then you can narrow it down. And the algorithms for doing this can be very efficient. In fact, this is how they screen donated blood for HIV right now. So again, we have, and if he wanted now a clinical collaborator, someone who had these materials, he could immediately go on to this site and find out who they were. We don't require to be on the site, and Howie can correct me later, that you have a grant, you just have to have a project. So I think that's another thing we've worked very hard to do. Right now, we also have been working very, very hard on getting in these grants for COVID-19 supplements that have been available. So we are told by our political people that there will be $30 billion of increased research funding coming out of this pandemic, about $10 billion of which will go to the NIH. And so one of our biggest efforts is to be there to assist investigators in putting grants together. I mean, obviously, even though most people in the office have PhDs, we're not expert in a wide area of a science. But if you're doing something with 4 institutions or 3 schools of the university, we're whizzes of getting through the bureaucracy, of getting those letters of cooperation, of making sure your grants are there. So in that sense, we're there to help you move forward. And the final thing we're doing, as I say, I'm not going to, I hope, run out of time here, is we're managing the ramp up. So it is not clear, but we hope to have people back in the laboratories to some extent by the middle of May. This means we have to anticipate animal needs. We have to anticipate how much PPE we need to have in central storerooms so people have it. It means we need to be able to answer the questions that people have on starting up. Obviously, social distancing is going to be important, but it is, I think, everybody wants to get back to work and get back to work safely. And again, we are not the decision makers. The dean has committees, the provost have committees, the committees have committees. But we are the place that will actually handle a great deal of the logistics of this. So we are there to work with every lab on getting back online and getting started. There are different approaches to this throughout the university. There is some feeling that the return should be prioritized based on whether you have papers to get out. We have decided that we can't, there are too many labs and we really can't decide who gets the highest priority. So our hope is to get all labs back in a graded way as quickly as safely possible. As I say, we're aiming for the 18th of March, 18th of May for bringing back the labs across the medical center. I cannot speak more widely for the university, but I'm guessing a similar sort of time. So that's what I have to say. I'll take any questions and try to answer them as best as I can.
Thank you, Mike. I'd like to ask a question. Sort of knowing now the factors that influenced the shutdown of the labs, is part of the ramp up process to plan for what may be a worse situation or at least a worsening situation in the fall? Will we have to shut down again, or will we just have to make sure that we have enough PPE that all lab members are essentially protected?
Well, I think, and certainly the university-wide planning committee, which Rui Costa has been convening and chairing, one of the things they're trying to look at hardest is what happens if there's an uptick, if there's a second wave. So some things are clear. We will not be caught short of PPE like we were this time. We also will have we will also have the ability to test people. We will have the ability to see who has antibodies, and maybe by that time, we might even know how antibodies correlate with immunity, which, as Florian pointed out, right now we're in the dark. Chile is giving out immunity passports, but that's not much of an assurance. And perhaps by summer we'll know more. The other thing is that we may know more about whether they're effective therapies. Right now, it's true that Sinai has treated 200 people with compassionate use of immune serum, immune plasma. The problem is they have no way of knowing if it worked. But by that time, we will have, from a lot of controlled studies of the immune plasma, we will have an idea if that's an effective therapy. So there are a lot of things that can change, but I think we all have to be ready to ramp down. But I think that I would personally do it a different way. I would ask each lab to ramp down by developing a plan to have maybe 2 people at a lab at a time and maybe work 24 hours a day, maybe work weekends. Making core facilities available around those times is also going to be hard. The biggest problem, in addition to everything else, two major problems. Many of our staff have lost their childcare, where it's available to use it, and that's going to make scheduling additionally difficult. And the final thing is that as someone who lives in Brooklyn and routinely took the subway on nasty days, nice days I ride my bike, I'm not sure I really want to get on the subway right now. So we have to look at how we're going to make our people secure moving back and forth.
Okay, thank you, Mike. We have one more question from Jailong Wang.
Yeah, I just have a quick question. Speaking of the magic date, May 18th, can we plan for some animal purchase import after beyond May 18th?
You can plan for animal purchases now, and if you need to get your breeding colonies and things, I'm waiting for Brian Karolewski and the Institute for Comparative Medicine to send out a thing, but we have enough animal care people, and we actually want to encourage people, if you need breeding animals, to order them now, because we think as this hold comes off in universities, we have to remember that our suppliers have also ramped down. And we don't want to be at the back of a long queue to get the animals we need. So please, if you have requests, put them in now. Dr. Karolewski will look at them. If he has the capacity to handle it, we'll push it up. And we will send out a memo within this week encouraging people to begin animal orders.
Wonderful. Thank you so much.
Okay, thank you, Mike.
Thank you very much for having me, Eric.
Thank you.